I need to tell you about something that happened 3 weeks ago that still shakes me. A 71-year-old man named David came to see me with swelling in his left calf. He'd noticed it for about a week. Tightness, warmth, a dull ache that wouldn't go away. He thought it was just a pulled muscle. When I examined him and did an ultrasound, my heart sank. He had a deep vein thrombosis, a blood clot that could break loose at any moment, travel to his lungs, and kill him instantly. My name is Dr. Richard, and I've been practicing vascular medicine and hematology for over 34 years. I'm 67 years old myself, and I understand exactly what happens to blood clotting after 60. I've watched too many patients suffer strokes, pulmonary embolisms, and heart attacks from blood clots that could have been prevented. Here's the truth most doctors won't tell you clearly. After 60, your blood becomes significantly more prone to clotting. Your blood vessels become damaged and inflamed. Your circulation slows down. You're less active, which means blood pools in your legs. The risk of developing dangerous blood clots increases by 300 to 400% compared to when you were younger. But here's what changed David's life. There are 5 specific vitamins that have scientifically proven abilities to help prevent blood clots, improve circulation, and even help dissolve existing clots when used properly. These aren't experimental treatments. These are vitamins with solid research showing their effects on blood clotting mechanisms. David's story didn't end with fear and emergency treatment. Yes, we started him on immediate medical anticoagulation. That was essential. But we also implemented these 5 vitamins as part of his long-term prevention strategy. 6 months later, his clot had completely resolved, his circulation improved dramatically, and his clotting markers normalized. After 60, your body's natural anticoagulation systems become less effective. Your blood vessel walls produce less of the substances that prevent clotting. Your liver becomes less efficient. Your inflammatory markers increase, which promotes clot formation. Today, I'm revealing the 5 essential vitamins that help prevent and address blood clots in your legs after 60. I'll explain exactly how each one works, what the research shows, and what dosages are effective. Number 5. Vitamin E, the clot preventer. Let me start with a vitamin that most people associate with skin health, but it's actually one of the most important nutrients for preventing blood clots. Vitamin E. And I'm not talking about synthetic vitamin E in most cheap supplements. I'm talking about natural vitamin E with mixed tocopherols that has genuine antiplatelet and anticoagulant effects. Here's what's happening in your body. Blood clots form when platelets stick together and create a mesh. After 60, your platelets become hyperactive. They clump together more easily than they should. Vitamin E directly inhibits this platelet aggregation, making your blood less likely to form inappropriate clots. I had a patient named Patricia, 68, who had a history of superficial clots in her legs. She'd get painful, hard lumps along her leg veins several times a year. We started her on natural vitamin E, 400 international units daily of mixed tocopherols. Within 3 months, her clotting episodes stopped completely. 1 year later, she hasn't had a single clot. Research published in Circulation showed that vitamin E supplementation reduced platelet aggregation by up to 35% in older adults. The effect was most pronounced in those with previously elevated clotting risk. But here's what makes vitamin E particularly important after 60. It also protects your blood vessel walls from oxidative damage. Damaged vessels are sticky and prone to clot formation. Vitamin E acts as an antioxidant, keeping vessel walls smooth and healthy. The key is using the right form. Natural vitamin E, D-alpha tocopherol with mixed tocopherols, is significantly more effective than synthetic vitamin E, DL-alpha tocopherol. Check your labels carefully. Natural vitamin E costs more, but works far better. The effective dosage for clot prevention is 400 to 800 international units daily of natural vitamin E with mixed tocopherols. Take it with a fat-containing meal for best absorption since it's fat-soluble. When I started taking 400 IU of natural vitamin E at age 65, I noticed within 6 weeks that the heavy, achy feeling in my legs at the end of the day had improved. My circulation felt better. The nighttime leg cramps I'd been experiencing stopped almost completely. Start with natural vitamin E tomorrow. This simple, affordable vitamin can significantly reduce your clotting risk. Number 4. Vitamin K2, the circulation protector. Now I'm going to tell you about a vitamin that sounds contradictory at first. and it confuses many of my patients. Vitamin K2. You might be thinking, wait, doesn't vitamin K help blood clot? Why would that prevent clots? This is where understanding the difference between K1 and K2 becomes life-saving information. Here's the critical distinction. Vitamin K1 is involved in blood clotting. It helps your blood clot when you're injured. But vitamin K2 does something completely different. It directs calcium away from your blood vessels and into your bones where it belongs. After 60, calcium builds up in your arteries, making them stiff and damaged. These damaged, calcified vessels are where dangerous blood clots form. Think of vitamin K2 as the traffic director for calcium in your body. Without adequate K2, calcium deposits in your artery walls, creating rough, damaged surfaces where platelets stick and clots form. With proper K2 levels, calcium stays in your bones, your arteries remain smooth and flexible, and clots are far less likely to develop. I had a patient named Frank, 73, who had significant arterial calcification shown on his imaging. His legs felt heavy, he had poor circulation, and he was at high risk for clots. We started him on vitamin K2, 180 micrograms daily of the MK7 form. Within 6 months, his repeat imaging showed measurable reduction in arterial calcification. His circulation improved, and his clotting risk markers decreased significantly. Research in the Journal of Thrombosis and Hemostasis showed that vitamin K2 supplementation reduced arterial stiffness and improved vascular health in older adults. Participants with adequate K2 levels had 50% lower risk of arterial calcification and subsequent clot formation. But here's what most people don't know. Vitamin K2 deficiency is extremely common after 60. Your dietary intake is typically low. K2 is found mainly in fermented foods and certain animal products that most people don't eat regularly. Your gut bacteria, which produce some K2, become less efficient with age. The result? Your arteries become calcified highways for clot formation. The form matters enormously. Vitamin K2 as MK7 is the most bioavailable and longest-lasting form. It stays in your bloodstream for hours, providing continuous protection. MK4, the other common form, is cleared within hours and requires multiple daily doses. The effective dosage for vascular protection is 180 to 200 micrograms daily of vitamin K2 as MK7. Take it with a fat-containing meal since it's fat-soluble. Many people take it with their vitamin D supplement since they work synergistically. Critical warning: if you're on warfarin, Coumadin, do not take vitamin K2 without your doctor's supervision. It can interfere with the medication. However, if you're on newer anticoagulants like Eliquis or Xarelto, vitamin K2 is generally safe and beneficial, but still discuss it with your doctor. When I started taking vitamin K2 at age 66, I noticed within 3 months that my legs felt less heavy at the end of the day. The tired, achy feeling in my calves improved. My vascular ultrasound showed my arterial flexibility had improved measurably. Frank told me after 1 year on vitamin K2 that he felt like his legs had come back to life. The heavy, sluggish feeling was gone. His circulation had improved so much that he could walk twice as far without leg pain. His risk of developing clots had decreased substantially. Vitamin K2 doesn't just prevent clots, it actually helps reverse the arterial damage that makes clots likely. This is preventive medicine at its finest. By keeping your arteries smooth and flexible, you're removing the rough surfaces where clots want to form. Number 3. Vitamin C, the vessel strengthener. Now let me tell you about a vitamin that most people think is just for immune health, but it's actually critical for preventing blood clots through a mechanism that few doctors even discuss. Vitamin C. And I'm talking about therapeutic doses that go far beyond the minimal amounts recommended for preventing scurvy. Here's what's happening in your body after 60. Your blood vessel walls are made of collagen and elastin fibers that keep them strong, smooth, and flexible. Vitamin C is absolutely essential for producing and maintaining this collagen. Without adequate vitamin C, your vessel walls become weak, develop tiny cracks and rough spots, and these damaged areas are exactly where blood clots love to form. Think of your blood vessels as highways. Smooth highways allow traffic to flow freely, but highways full of potholes and rough patches cause traffic jams and accidents. Vitamin C keeps your vascular highway smooth and well-maintained, preventing the conditions that lead to clot formation. I had a patient named Dorothy, 69, who bruised easily and had visible spider veins all over her legs, both signs of weak blood vessels. She also had a history of superficial clots. When we tested her vitamin C level, it was barely above deficiency. We started her on 1,000 milligrams of vitamin C twice daily. Within 2 months, her bruising decreased dramatically. Within 6 months, her vein health improved visibly, and she hasn't had a clot since. Research published in Free Radical Biology and Medicine showed that vitamin C supplementation improved endothelial function, the health of blood vessel lining, by up to 50% in older adults. Better endothelial function means smoother vessel walls and significantly reduced clotting risk. But vitamin C does something else crucial for clot prevention. It's a powerful antioxidant that reduces inflammation in your blood vessels. After 60, chronic inflammation damages vessel walls and activates your clotting cascade inappropriately. Vitamin C directly reduces this inflammatory damage. Here's what makes vitamin C particularly important. Your body cannot produce or store it. You must get it daily from diet or supplements. After 60, your absorption decreases and many medications deplete vitamin C. Most seniors are functionally deficient without realizing it, and their vessel walls are suffering the consequences. The RDA for vitamin C is only 75 to 90 milligrams, barely enough to prevent scurvy. For therapeutic vascular protection and clot prevention, you need 1,000 to 2,000 milligrams daily, divided into 2 doses for better absorption. Your body can only absorb about 500 milligrams at once, so splitting the dose maximizes benefit. Use buffered vitamin C or calcium ascorbate if regular ascorbic acid bothers your stomach. Take it with meals for best absorption and minimal digestive upset. When I increased my vitamin C intake to 1,000 milligrams twice daily at age 65, I noticed within 1 month that the small spider veins appearing on my legs stopped progressing. The tiny broken capillaries on my face that had been developing gradually faded. My gums stopped bleeding when I brushed my teeth, another sign of improved vascular integrity. Dorothy told me after 4 months that she felt her legs were healthier than they'd been in years. The heavy, achy feeling improved. The visible vein problems diminished. Most importantly, her clotting risk markers decreased substantially on her blood work. Number 2. Vitamin D, the inflammation reducer. Now I'm going to tell you about a vitamin deficiency that's present in over 80% of my patients over 60, and it's directly increasing their risk of blood clots through a mechanism that most doctors completely overlook. Vitamin D, and I'm not just talking about bone health, I'm talking about its profound effects on inflammation and blood clotting. Here's what's happening that nobody tells you. After 60, chronic low-grade inflammation throughout your body activates your clotting system inappropriately. Your blood becomes hypercoagulable, too ready to clot. Vitamin D is one of the most powerful anti-inflammatory substances your body produces, and when you're deficient, inflammation runs wild and triggers excessive clotting. Research shows that vitamin D directly regulates the genes that control clotting factor production. When your vitamin D levels are optimal, your body produces clotting factors in proper balance. When you're deficient, the balance shifts toward excessive clotting. This isn't theoretical, it's measurable on blood tests. I had a patient named George, 72, who had multiple risk factors for clots. He was overweight, sedentary, and had diabetes. When we tested his vitamin D level, it was only 18 nanograms per milliliter, severely deficient. We brought his level up to 50 nanograms per milliliter over 3 months, and his inflammatory markers dropped by 40%. His blood viscosity improved. His clotting risk decreased substantially. A landmark study in thrombosis research followed over 10,000 adults and found that those with vitamin D levels below 20 nanograms per milliliter had 2.5 times higher risk of developing blood clots compared to those with optimal levels above 40 nanograms per milliliter. The relationship was direct and dose-dependent. But here's what makes vitamin D deficiency so common after 60. Your skin produces 70% less vitamin D from sunlight compared to when you were 30. Even if you're getting sun exposure, your aging skin simply can't manufacture adequate amounts. Your kidneys, which activate vitamin D, become less efficient. Most seniors are walking around severely deficient without knowing it. The problem is that standard medical care considers anything above 30 nanograms per milliliter as sufficient. But for clot prevention and inflammation control, you need levels between 40 to 60 nanograms per milliliter. This requires intentional supplementation, not just dietary sources or casual sun exposure. The effective dosage varies by individual, but most people over 60 need 4,000 to 6,000 IU of vitamin D3 daily to reach and maintain optimal levels. You must use vitamin D3, cholecalciferol, not D2. D3 is far more effective at raising blood levels. Critical point: vitamin D is fat-soluble, so take it with a meal containing healthy fats for proper absorption. I take mine with breakfast along with eggs and avocado. Vitamin D doesn't just prevent clots, it reduces the chronic inflammation that's driving excess clotting throughout your body. It's addressing the problem at the cellular and genetic level. Most people have no idea that vitamin D deficiency is silently increasing their clotting risk every single day. The inflammation it allows to run unchecked is activating clotting cascades that shouldn't be triggered. Get your vitamin D level tested immediately. If it's below 40 nanograms per milliliter, start supplementing with 5,000 international units of vitamin D3 daily with a fat-containing meal. Retest in 3 months and adjust dosage to maintain levels between 40 to 60 nanograms per milliliter. This single vitamin correction can reduce your clotting risk by 40 to 50% within just a few months. It's one of the most important interventions you can make for vascular health after 60. Number 1. Vitamin B complex, the homocysteine fighter. Here it is, the most critical vitamin group for preventing blood clots after 60, and it works through a mechanism that most doctors never check. B vitamins, specifically B6, B9, folate, and B12. These 3 vitamins control a dangerous compound in your blood called homocysteine, and elevated homocysteine is one of the strongest predictors of blood clots in older adults. Here's what's happening in your body. Homocysteine is a toxic amino acid byproduct that damages your blood vessel walls, creates inflammation, and directly promotes blood clot formation. After 60, your homocysteine levels naturally rise because your body becomes less efficient at breaking it down. The only way to keep homocysteine low is through adequate B vitamins. They're the enzymes that convert homocysteine into harmless substances. I had a patient named Elizabeth, 70, who developed a DVT in her leg despite no obvious risk factors. When we tested her homocysteine level, it was 18 micromoles per liter, dangerously elevated. Normal should be below 10. We started her on a high-potency B complex with methylated B vitamins. Within 3 months, her homocysteine dropped to 8 micromoles per liter. 1 year later, she remains clot-free with normal homocysteine levels. Research in JAMA showed that elevated homocysteine increases blood clot risk by 300 to 400%. Every 5 micromoles per liter increase in homocysteine raises clot risk substantially. But here's the powerful part. B vitamin supplementation can lower homocysteine by 25 to 40% within weeks. After 60, B vitamin deficiency becomes extremely common. Your stomach acid production decreases by 40%, which impairs B12 absorption. Many medications deplete B vitamins. Your diet often lacks adequate folate. The result? Rising homocysteine levels that silently damage your vessels and promote clotting. The critical detail: you need methylated B vitamins, not the cheap synthetic forms. Use methylcobalamin for B12, methylfolate for B9, and P5P for B6. These methylated forms work immediately without requiring conversion by your liver, which becomes less efficient after 60. The effective dosage for homocysteine control: B12, methylcobalamin, 1,000 micrograms, B9, methylfolate, 800 micrograms, and B6, P5P, 25 to 50 milligrams daily. Many high-quality B-complex supplements contain these amounts in methylated forms. When I started taking methylated B vitamins at age 66, after discovering my homocysteine was 14 micromoles per liter, within 2 months it dropped to 7 micromoles per liter. My vascular inflammation markers improved. The occasional numbness in my feet, an early sign of vascular problems, disappeared completely. Elizabeth told me that normalizing her homocysteine was the most important intervention for her vascular health. She felt her circulation improve, her energy increase, and her fear of another clot diminish as her numbers stabilized. I recommend every person over 60 get their homocysteine level tested. It's a simple blood test that costs $30 to $50. If your level is above 10 micromoles per liter, you need B vitamin supplementation immediately. I've revealed the 5 essential vitamins for preventing and addressing blood clots after 60. Vitamin E to prevent platelet aggregation. Vitamin K2 to remove calcium from arteries. Vitamin C to strengthen vessel walls. Vitamin D to reduce inflammatory clotting triggers. And B vitamins to control homocysteine, the most dangerous clotting promoter. David, the patient from the beginning, implemented all 5 vitamins under medical supervision alongside his anticoagulation therapy. His clot resolved, his circulation normalized, and his clotting risk markers improved dramatically. He's now thriving at 72. I take 4 of these 5 vitamins daily. My circulation is better now at 67 than it was at 62. My clotting markers are optimal. My legs feel healthy and strong. After 60, your clotting risk increases dramatically, but you're not powerless. These 5 vitamins address the mechanisms that cause clots, damaged vessels, inflammation, hyperactive platelets, and elevated homocysteine. Critical reminder, if you're on anticoagulation medication or have active clots, work with your doctor before adding these supplements. They're powerful and can interact with medications, but when used properly, they're life-saving. Start by getting tested. Vitamin D, homocysteine, and a comprehensive metabolic panel. Know your baseline. Then implement these vitamins systematically with medical guidance. Give your body 3 to 6 months. Watch your circulation improve. Watch your risk markers normalize. Watch your legs become healthier and stronger. Blood clots aren't inevitable after 60. With these 5 vitamins, you're giving your body the tools it needs to maintain healthy circulation and prevent dangerous clots. Your vascular health starts today. Your protection begins now.